President Cyril Ramaphosa is set to sign into law the National Health Insurance Bill today, a move that is set to unleash a barrage of legal challenges. Key industry players such as the Association for Medical Schemes, Trade Union Solidarity and South Africa's biggest doctor organization says they're poised to take their grievances to court. Now, further opposition to the bill is expected from other healthcare professionals and organized business. The bill sets in motion the government's plans for achieving universal health coverage and seeks to scrap South Africa's a two-tier health system in which the majority of the population depend on the overburdened public sector system and a minority have access to private care funded by medical scheme membership. But detractors have stated that there has been a lack of consultation and a failure to take substantive concerns into account when drafting the bill. Now, reading the room, it is clear that the anticipation is largely that NHI is likely to fail dismally in its current form. IntriHEALTH, in the meantime, specializes in bringing healthcare to people across the African continent and has recently concluded a collaboration with Zambia to provide healthcare to the most in need. Company CEO Mike Simpson strongly believes that the private sector can work hand in hand with the state to ensure healthcare for all. He joins us now. Mike, an absolute pleasure and a good afternoon to you.
Good afternoon. Thank you.
Brilliant, Mike. Maybe we can start off by really just speaking about the issue of NHI from a South African context. I don't think, and it's important to say that nobody is debating the necessity for some sort of reform. That at this point what we have isn't sufficient and we do need to see some change.
Definitely. The NHI, I think, is going to happen either way. It happens throughout the rest of the world. It is just, I think the focus needs to be on bringing healthcare to the people. The emphasis is that there's a lot of healthcare that is needed in these outlying areas. And how do we do it? The payment thereof, yes, there is a business that needs to be funded correctly, but we have to focus on really how do we bring the healthcare to the people.
I must ask you also about, the NHI from your perspective here. There are some opposing views, and I am, convinced that it's not the most perfect piece of, policy that we have, released as a country. What are your thoughts on it, Mike? What might be some of the contentious issues that are getting in the way of us using this document to get healthcare to the people?
I think it's about deliverable. My personal sentiment is really about quality deliverable. On the private sector, we see great quality being given to the people. And now, how do we get that to everybody else? I think that's really the biggest issue. I think all players agree that the quality of health needs to be uplifted. Is this the bill the right way? Everybody's going to argue it. There's pros and cons. But really, I think it's about the deliverable, the sustainability, I think is a very big thing. How is it going to be funded? Because ultimately, somebody needs to pay, and it's going to be the taxpayers, be it the companies, your personal taxes, or via VAT. So we're all going to pay. But can we get quality healthcare at an affordable price?
Let's also ask you about, just healthcare inflation here in South Africa. And I'm wondering if it's a phenomenon all around the world, Mike. What we do see in South Africa is that healthcare inflation runs ahead of CPI consistently. And that has various, inputs for it. Some of it looking at technology and the price of technology when it comes to healthcare and having to factor that into, healthcare needs here. And I'm wondering from that perspective as well, if we bring in, tools like the NHI, can they address that kind of thing?
I don't think the buying power per se is going to help because the supplies of the equipment and the drugs, etc., is exorbitant. And we need to address that. So as a collective government going to go and buy or negotiate these deals, I don't believe it's really going to substantially reduce it. We have to use technology and we have to transcend the way we've been doing things to bring that cost down. But the cost is there. It is exorbitant in South Africa. I know different places overseas you can get let's say an MRI or a CT substantially less than we can get it in South Africa. And we need to explore that to see where are the costs lying. Is it with the manufacturers of the equipment? Is it with the service provision? Who's at fault? And I think it's collective. I think it's a collective that we need to address. How can we make it affordable to everybody and bring that inflation cost down? I think there's possibly too much profit that's been left on the table. Unfortunately, I think on the government level, there's been a lot of corruption that needs to be addressed. Because we eliminate that, we utilize technology, we use clever means of tracking where the funds are going, like a blockchain mechanism, where it's transparency, we can bring the cost down.
It's a very interesting one that you put on the table for us, Mike. Let's also talk about, the very necessary players that we need to have around the table reaching consensus. I think you would have seen in my intro, doctors threatening to litigate against this bill. For me, if, the most important people cannot sit around the table and agree to move ahead with this NHI, then it's already a dud. I'm keen to get your thoughts on that one as well.
It's challenging, and we have to look from a personal point of view. We have to look who's making the noise. We've got unemployed doctors in South Africa. That's got challenges in itself. We've got private doctors that charge a fortune for a consult because the medical aid rate that said you can charge that, and they charge that. Is it justifiable? If you go for just a simple ear inspection, and you're walking out 800 Rand later, is that justified for 5 minutes consultation? We don't know. So it's a challenging one. It's really a very challenging one, but we have to take money off the table. We have to say, is this not about bringing healthcare to the people? Is this not about upliftment of our workforce? If we've got a healthy workforce, if they've got access to good quality care, would that not assist in productivity? And we have to take the noise about the profitability. Everybody needs to make profit. We understand that. We're all in business. But it needs to be realistic profit, not exorbitant profit. And also for the effort that we're putting in. If you're working hard, if you're doing your 18-hour days, yes, earn a lot of money. But if you're not doing those hours, and you're still earning a lot of money, I think there's the imbalance.
Well, Mike, it's all we have time for today, and keen to keep talking as all of this emerges. We'll see what happens at 2 p.m. this afternoon. Thank you so much. That was Mike Simpson. He's CEO of IntriHEALTH.